Welcome to another presentation by My Weight World. The title of this presentation is Acomplia, Medication for Weight Loss. The goal of this presentation is to provide a brief overview of the weight loss drug Acomplia. It is not to replace the advice or information you should get from either your pharmacist or doctor. Please consult with your doctor or pharmacist for additional details. History. Acomplia has not yet been approved, summer of 2006, by the Food and Drug Administration, the FDA. The manufacturer applied for approval in 2005. Predicted approval 2007. Acomplia was approved for usage by the European Medicines Agency, EMEA, in April of 2006. Some technical issues. The generic name of Acomplia is rimonabant. There is some speculation that the actual name for rimonabant in the United States will be Zimulti, and that it will remain Acomplia in Europe. Acomplia will require a prescription from your doctor. Like other weight loss drugs, Acomplia works in the brain, but differently from all other drugs. Acomplia is not only a potential weight loss drug, but also an anti-smoking medication. It is possible that the FDA could approve Acomplia for either weight loss or smoking, or both. The EMEA has only approved Acomplia for weight loss at this point. Let's look at how Acomplia works. It works in the brain. Acomplia is a selective CB1 endocannabinoid receptor antagonist. Cannabinoid is marijuana. It works by blocking endogenous cannabinoid binding to neuronal CB1 receptors. Activation of these receptors by endogenous cannabinoids increases appetites. In other words, Acomplia blocks receptors that would normally increase appetite. A great question is how it was developed. It developed from the knowledge that cannabis, marijuana, smokers often experience extreme hunger pains. In other words, cannabis stimulates appetite. Therefore, if a drug can be found that blocks cannabinoid receptors in the brain, it may reduce appetite. The manufacturers then looked for drugs that do just that, block the cannabinoid receptors. This is how Acomplia was born. Let's now talk about some research. The effects of Acomplia on weight loss, weight maintenance, and weight regain have been assessed in a series of clinical studies. The most important was the Phase 3 multi-center rimonabant in obesity trials. These studies included more than 6,000 patients in both the U.S. and Europe. After 1 year of taking Acomplia, many people experienced continued weight reduction and prevention of weight gain into the second year. Patients taking 20 milligram tablets each day achieved significant reductions in body weight, as well as an improvement of their cholesterol and blood sugar compared to those taking a placebo, also known as sugar pills. In one study, those taking 20 milligrams of Acomplia a day lost an average of 20 pounds after 1 year compared to those taking placebo pills who lost an average of 5 pounds. However, those that stopped taking the drug as predicted appeared to regain their weight. One final note on Acomplia research. Ongoing trials of Acomplia are looking in more detail as to the benefits of the drug beyond weight loss to improve other medical conditions such as diabetes, high cholesterol, cardiovascular disease. Let's now talk about a few practical concepts concerning Acomplia. How long will you be able to take Acomplia for? A good question. In research studies, the use of Acomplia for 2 years showed it to be safe for most people taking the medication. The use of Acomplia for more than 2 years has not been studied or proven. The question is this just then a short-term drug? More studies are needed to show that the drug is both safe and effective beyond 2 years. As of now, the length of time that you can take this drug will be up to your doctor. Remember, Acomplia is yet to be approved by the FDA. Indications for the use of Acomplia. This drug is for the purposes of treating obesity. Therefore, only people with a BMI of 30 or 27 in the presence of other risk factors should be taking this drug. Ideally, taking Acomplia in conjunction with a reduced calorie diet and appropriate physical activity may be beneficial as opposed to just taking Acomplia. Consult with your physician. Acomplia is not indicated under the following circumstances. Someone who does not meet the weight criteria mentioned previously. Other exclusions set by the FDA and EMEA. Since the drug is not yet approved by the FDA, these exclusions are not yet published. You may ask, what about the side effects? In the studies to date, some people taking Acomplia had a higher rate of the following side effects, including nausea, anxiety, depression. Let's discuss the relationship between Acomplia and marijuana users. Many people use marijuana for medical as well as recreational uses. What will happen when an obese marijuana user takes Acomplia? Since marijuana is an appetite stimulant and Acomplia is an appetite suppressant, working on the same receptors in the brain, the questions are, will Acomplia not work? Will the effects of marijuana be negated? No one officially knows. What about Acomplia and other medications? This will become clearer if approval from the FDA comes through. If you are from Europe, please consult with the EMEA. Smoking. Acomplia may also be used as an anti-smoking medication. It is unclear if the FDA and the EMEA will approve the drug for both weight loss and anti-smoking. Alcohol. Research is ongoing to see if Acomplia will help fight other addictions such as alcohol abuse. Pregnancy. The FDA has not made any comments on the usage of the drug and pregnancy. Expect guidelines to come out once the drug is approved. Driving a car. It appears that Acomplia should not interfere with your ability to drive a car. However, you should be on the alert for any signs of fatigue, sedation, or lack of alertness. Summary. Let's summarize what we have learned about Acomplia. Acomplia has been recently approved by the EMEA for use in some European countries. As of the winter of 2006, Acomplia has not yet been approved by the FDA. It appears that Acomplia will be relatively safe. On the average, patients lost 20 pounds if they took 20 milligrams for a year. However, the weight returned when the drug was stopped. Safety and effectiveness beyond 2 years needs to be shown. There are some side effects like any other drug. This is a novel new appetite suppressant. It may decrease other addictions such as smoking and alcoholism. However, time will tell if this will be proven. After approval by the FDA, see a doctor if you wish to further discuss Acomplia. Do not rely on this presentation for the usage of Acomplia. This has been another presentation by My Weight World.